going to attempt to pronounce your last name here in a minute when I introduce you. I'm just giving you a heads up.
I'll do it for you.
Okay, I'm going to pause and let you.
Yes, Molly can do it for me, for sure.
I can do it so well.
Are you driving as well, CG? Are you driving?
Actually, I'm in my car. I'm doing my school hours for my practicum, so I just come out to my car real quick because I have bad service in the residential treatment center I'm at right now. So.
Gotcha. Trying to see what time it is. My time. We're going to give it just another minute or two, Molly, just because people are still logging on. Just maybe another minute.
No problem.
Then we'll take off.
No problem.
Just want to make sure everybody's included before we get started.
Excited to see so many faces.
I keep wanting to do one of these where we like pass things from block to block.
Hey, Susan, can you push record whenever you get started?
I have, but it wouldn't let me.
Somebody's gonna have to do it from my computer.
I think I've got it recording.
Okay.
So let's see. You do have it recording, Ashley?
Yes.
Okay, cool. Gotcha. All right, well, I think it's 3:02, so I'm going to go ahead and get started just to keep everybody on the correct time frame that we normally, these don't go over an hour, Molly and CG, just to give you a heads up. So, and we're very casual with our Zoom socials, so normally I just want to welcome everyone. Thank you all for being a part of this today. We haven't had a social in a few weeks, so we're glad to get back together with everyone. We are just a little bit of housekeeping. Normally the way we do this is I ask questions of our guests, and if you have a question that comes about from what we're talking about, you can either raise your hand, unmute yourself, and just interject, or there's a chat box right down in the middle center part of your screen. You're welcome to just type in the chat box, and we will monitor those and kind of answer those questions as we go. So again, want to thank everybody for taking time out of their day to be a part of this. And we have two special guests with us right now. Miss Molly Marshall, if you'll wave up there. I can see you. I don't know where you're at on everybody's computer. Molly used to be with CASA, so she knows a lot about CASA, and she's currently a social worker with the START team, and we're going to explain what that is here in just a little bit. And also, we have Miss CG. Someone else?
From KO.
There you go. I can't say it. I can see it, but there's no way I would have said it right. CG is a mentor with the START program. So we have a social worker and a mentor on, although I know CG can't stay with us very long. So we'll try to ask her questions early on. So can't thank you both enough for being a part of this today and kind of updating us a little bit and educating us on what the START team does. And for those of you who do not know what the START team stands for, that START stands for Sobriety, Treatment, and Recovery Team. And it is a child welfare-based intervention program for families of young children that are affected by parental substance abuse and child maltreatment. I believe it began here in Davis County back in about 2007, but that's...
I believe so, yes.
Okay.
Yeah.
And my next thing is one of you, I'm going to pass it off to either Molly or CG to give us a little bit more of an update of what the description of START is.
Okay. So I'll kind of just introduce myself. I'm Molly again, and I am the ongoing worker. I'm an ongoing worker. I'm one of three. We have 3 dyads on our team, and the dyad consists of me, which is the social worker, and then we have a family mentor, and CG is my family mentor, my partner, and we work together to make decisions for the welfare and the well-being of the family. And we have 2 very separate roles, but then we come together to, we're a team. So we come together to make, all like really, really informed decisions. And And CG can kind of tell you, I'm the ongoing worker, so I'm kind of more focused on the child welfare, the family, how things are going with visits, how are things in the home, the safety and the well-being of the child. And then CG is more focused on the parents and their journey to recovery. So CG can kind of tell you a little bit more about her role.
Hey, again, I'm Stevie, like Molly said, so I'm her partner. To be a family mentor, you have to be a person in long-term recovery. START wants you to have 3 years, so you're kind of stable in your recovery, so you're able to, mentor parents on their sobriety journey. Like Molly said, she's mostly focused on the family and children, even though she has a lot of knowledge herself about recovery too. But I focus more on, what are the clients doing for the recovery? How are they getting healthier to be able to take care of their families and children, to navigate the road of what does their treatment look like? Sometimes I mentor them on the 12 steps, things that I'm familiar with. And even if I'm not, we can find information, that might help them, because everybody's path is different. We just try to meet the client where they're at. Like Molly said, we always talk about things before we make a decision on how to move forward with the family. And that means her having a plan too, and she always asks me about the children. So we just try to always work together and make decisions. And I think that it's healthy for parents because they get two of us, and they feel like they really have a team on their side. So that's pretty much right now what I can think of. So.
That was actually one of my follow-ups after you both described what it is you do, was do all START cases have both? They have that team of a social worker and a mentor always, is that correct?
Always.
Yes.
Yes.
Mm-hmm.
And our team is actually, like, we have the dyad, which is, we're kind of like the ground, we're the ground workers. We're in there with the families, but the treatment team is much bigger, and we all work together to, help the family. But we have a treatment provider that works with us. So, our clients get the services just right. Like, the case opens and we're head first.
Mm-hmm.
So,
Okay. Do all of your workers, how many you currently have? You said 3, so you have 3 teams. And if that's true, how many cases can each team take?
okay, so we have case caps because the START team is actually, we're trying to be approved as a best practice in child welfare. This is kind of an experiment in showing how smaller case loads and more intense services really can work. So I'm very fortunate that we have a case cap. So CG and I hold 15 cases is our maximum. And right now, CG and I have 13. Because Danielle Medley is our super.
I think I'm at 9.
So CG and I have 9.
Okay.
And then I'm working with another mentor until we get another worker hired.
I was just about to jump in and say, my uneducated knowledge of START, I thought you worked every case together. So if you have 13 and CG has 9, is that because you're working?
I work with another mentor right now.
Okay.
But when we hire another worker, it's going to be CG and I on all 15.
Okay, gotcha.
Yes.
Our cap.
And I'm going to stop real quick because I just kind of bypassed, but I don't know if you guys are aware, but we currently have several of our folks on our newly trained advocates that have never even had a case. In fact, they got sworn in this morning. Whoop, whoop.
Oh,
Again,
congratulations.
Yeah, we're very happy to have 10 new advocates, so that means that many more families we can serve. That being said, most of them are probably not familiar with any of these terms we're using as far as START. You guys that are new to the programs, START is something you'll hear in court a lot of times when you're working with families. The judge or the social worker or someone has referred the START team for a family, and that's who we're talking. I should have preface this entire Zoom with that, but just, I didn't want to leave you guys kind of out there wondering what exactly is going on. So that's what we're talking about, is the team START team that you'll hear references. There are lots of community partners and different organizations that get referred. There's something called FPP that we've talked about in the past on our Zoom social. So we're just trying to include all of the different programs that you might be hearing about. Just wanted to back up and let you, the folks that are new, know what we're talking about there. I'm sorry about that. I should have started with that. Who can, and you said it, but who can make referrals to START? I know DCBS can, or a social worker that's doing, an investigation can. Is that the only way you can get a referral to START?
Yes. So to get a referral to START, it actually has to start with an open investigation. So a report has to come through our centralized intake office. And these reports, we actually screen all reports. Our supervisor has access to all the reports that come in for the county. START has to have specific criteria to be referred. You have to have a specific criteria. Our ages, the children have to be ages 5 or have one child in the family, ages 5 and under. They can't have a current ongoing case, which means that they can't have a current court involvement with, family court, or a current case with another social worker.
Okay.
And so those are really the two really big requirements. And substance has to be the big issue. Is this is what is causing the neglect to occur, the substance use of the parent.
Okay, gotcha. All right, can you kind of explain to us, does anyone have a question so far as we're going?
I do one quick one. You may have already said, and from CG, I'll try to say her last name, Luang Gretko. So from her presentation, it looks like her responsibility is the child side of it. So for a case to be a START case, the child must be involved. It's not a service for adults who need sobriety treatment, correct?
No, it is not a program for primarily for adults. You have to have a child 5 and under because it is a child welfare program.
Okay.
To be involved with child welfare agency, yes.
All right, thank you.
All right. Robin, did you have something? Hold on, Robin's unmuted.
Yeah, I was just curious, Molly, you said if they're involved already, that would disqualify them from START, but wonder why that is. Looks like they might need that program even more if they're.
Well, so START is, like we said, we're kind of in a grant. It's an experiment. I mean, this is what it is. This is a long-standing program, and we are looking to change child welfare. But the reason that it can't be an ongoing case is because START has to be involved in the decision-making right from the very beginning of the crisis. That is where we have to, we get in there, and I can look at my timeline to kind of tell you, but some cases, when you get an investigation, and some ongoing cases, they already have an ongoing worker. You can get an investigation, and sometimes in other units, it could take 30 to 45 days to complete an investigation. And then it could be another 30 days before services can even start. The START team, when we identify and we accept the referral for the program, we have 10 days from the initial investigation to get the referral. However, we usually do not go the full 10 days. We have them in services within the first 3 to 4 days. So the reason why, it's just because the intensity, and we want to jump in right when the crisis happens. People who have ongoing cases already, I don't know, and that's a good question that I can ask our directors, but they just state that it's because services have probably already have been in place with their former case or the case that they have ongoing. Therefore, we can't add on.
Okay. Yeah.
They
But
have.
can I jump in? Sorry,
Thank you,
Mom.
Molly. No, thank you.
I was just going to jump in and say, as you know, a lot of times the cases are closed out, but then a new petition arises. If that happens down the road,
Hang on, I'm on a Zoom call, so I gotta, it's on my hearing aid, so hang on, let me get rid of the Bluetooth.
there you
Now,
go.
we have had cases, I know when you talked about petitions, like, okay, so we have had cases that a petition has been filed before the referral has been sent to Child Protection. Sometimes the family doesn't know to call us. Sometimes it's so emergent that they just go straight to the courthouse and they get emergency custody. In that instance, either an on-call worker is called, and sometimes the judge herself has contacted, because the report has to be made. Either the judge's staff has done it, or it comes through the court, and we have taken cases that way. But if they're closed, if the case closed out, say they closed out 4 weeks ago, and then something new has happened with substance use, and they can be in START.
Okay, good. That's good to know. I think that's kind of what we were wondering
Yes.
about.
Yes,
A new petition, because many times our cases will close out, and
they do.
I
They
mean,
do, yeah.
we talked about this in training, guys. There will be times when you might have, we refer to them as trailers, petitions, trailers, pretty much the same thing. A lot of times you might have a case that might have 16 that's gone over a course of a decade with the child from infancy to 10. Keep in mind, START does have to have someone, I believe, that's 5 or under in the home. So I guess that's a question as well. If they do have a 5-year-old, but they've also got multiple other children, you're going to work with
Yes,
everyone? Okay.
everyone. They just have to have one child that's 5 and under. So
Gotcha.
I have a caseload that I have a case that the oldest child is 17 and the youngest is a year old. So
Wow.
we.
That's crazy. No, I'm just kidding. I'm just kidding. Okay, and I think you've already said that, but I had it on as one of my follow-up questions. It's literally from the initial CPS referral, the investigation and the referral from CPS to START, to the parents being in, quote, intensive treatment is a 10-day period. Is that right?
Yes.
Is that all possible? Okay.
So we get the referral. When we get the referral, that is the phone call that jumpstarts the investigation. So that means somebody has called and said, for example, a baby was born at a hospital exposed to opiates. Every infant that is born exposed to a substance, we get that referral. We have 24 hours to respond to the hospital. So we usually get there the same day. Sometimes I've gone to the hospital when a baby's been 6 hours old. As soon as that referral is accepted, we go. We have 24 hours to go. And acceptance criteria, there's a bunch of time frames, but usually mostly it's 24 hours for my cases. So within that 24-hour period, say we go and mom says, yes, I used opiates throughout my pregnancy. Within 3 days, we're saying, okay, we have a program for you. This is what we have. This is what we offer. They accept, and within 2 to 3 days, we're all at the table making a plan for treatment. So it's very, very quick. I mean, within normally 3 to 5 days is what our county is really, really good about getting things in motion quickly. But some of the bigger counties, Jefferson, Kenton, they're 10 days within.
Right. Well, it sounds like every department in DCBS, you're short-staffed at the time being. That being said, if you are at capacity in your cases and you get a call from the hospital about a child that's been born that has a substance present, what do you guys, what do you do if you're at capacity for those?
When we are at capacity, which I used to be the investigator for the START team. So when I would have a case that I knew that we were at capacity or we could not accept the investigator, which is Serenity Halsey now. We work it very similar to how we would with START, but we don't have the mentor or the things. But when I would have a case that I couldn't accept for START services, I always would have the safety plan ready to go. Before they left the hospital, we always knew whether we were going to have to remove or try to put services with family, supervision with family. I almost always had a referral to a substance use, a treatment center immediately. Where whenever it got to the ongoing worker, which we would try to flip it over to the other unit very, very quickly. We would notify the other supervisors that this is what we have done. We have sent this family to True North for an assessment. We have supervisors that are going to have eyes on the child and the family is going to live here. We always had that plan ironclad so that when they went to the other unit, nobody was screaming, we're not scrambling trying to figure out what's happening. What are we doing?
Gotcha. And I kind of jumped ahead there. One of my questions way back before I got so far ahead was, what is can you give us a description of the timeline, not just that 10-day, but the entire timeline?
Oh, yes. Yes. Okay. So there's the first CPS referral. So we have 24 hours to respond. From that investigation, whenever I go out to the hospital, example, I have 10 days maximum to get the referral to start. But like I said, it doesn't take that long. We usually know pretty immediately. Once we've decided that, hey, we're going to do this, they're going to accept START services, we schedule a family team meeting within 3 days. And that's very, very strict. We cannot go over the 3 days. They have to have that first safety meeting within 3 days of the acceptance of the referral. At that FTM or the family team meeting, we have the worker and the mentor. We introduce ourselves to the family. We have the family support system there. And we have our treatment provider, which our treatment provider here in Owensboro is Mountain Comprehensive Care. We sit down and we kind of discuss, why you're here, what's happened, why are we involved? We kind of briefly over, like, hey, my baby was born exposed to opiate. And instead of sending them on saying, well, you have an appointment next week at 10 o'clock at Mountain Com for an alcohol and drug assessment, our treatment provider gives the assessment that day. So they have their assessments done and we come back within a few hours and we have the decision of this client's been recommended 30-day inpatient treatment. We have a bed date open. They're going to go tomorrow morning. And it's that quickly. And that starts off the opening case process. And the rest of the timeline is like, when we have our cases, I meet with my clients weekly for the first 60 days. So I see the children and I see the parents once a week, which other cases on other units only have to see their clients once a month. So I see mine once a week for the first 60 days. And then after, I see my clients twice a month. But since COVID happened, I see my clients every week. So that's how it.
How long does that go? How long do you stay involved?
We stay involved. The recommendations or the requirements to close your case successfully is 6 months consecutive sobriety, which means you have not failed a drug test for 6 months. And we provide free drug testing for our clients through Mountain Comprehensive. So our clients drug test twice a week. And so we're always aware of their drug screens. If there's a positive, we know pretty immediately, we intervene. But if they're sober and they complete treatment, it's usually, the shortest time frame is 6 months. But most of our cases can be open up to 2 years. We are either staying open 6 months and we close successfully, or we stay open until permanency is established. Say our clients are not able to maintain sobriety, which that happens sometimes, then we're there until permanency is established, either with permanent custody with a relative or adoption.
And we have a question real quick.
Yes.
We had a question in the chat box. Can you explain the difference in START and a program like Lighthouse?
Okay, yeah. So START is not a treatment provider. We contract with a treatment provider, but I'm not, like myself, I'm not a licensed clinical social worker. I'm not a licensed mental health therapist. I cannot make any clinical recommendations, nor could I offer treatment services myself yet, because I'm in grad school. But Lighthouse, like Lighthouse Recovery Services, and then the Lighthouse Counseling, they have licensed clinicians that are able to provide treatment services. So say I have a client that we contract with Mountain Comprehensive, but say they don't want to go there. We kind of let our clients, you have your own autonomy. You can choose where you want to go. So say they're like, I don't want to go to long-term treatment here. I want to go to Lighthouse. Then we're like, okay, we're going to get you there. And we work very closely with Lighthouse, Forensic Centers, or all the treatment centers within the state, and we get them in wherever they want to go. So they're an actual, drug treatment center.
Great. I know that the START team is that the primary focus is to work with the families to keep the children in the home and not removed. But if you go to a home and determine that there is actually risk in the home, how do you handle that, and what's your process?
So almost all of our cases, like Susan said, we start with supervision. So we have either the family staying with a safe person or a safe person staying with the family, because people will have better outcomes if they have their children with them. It's just, proven. However, we do have things that happen. Say the family, the supervision plan does not work. Family can't do it, or family is not being appropriate. We take charge of the situation very rapidly. We have an FTM almost immediately, family team meetings. We have a lot of them in START. We're constantly assessing, constantly meeting, but we kind of have what's called a come to Jesus meeting, where it's like, okay, so you need to give me another supervisor, or we're going to have to take this to court to try to find another way, either with custody going to another person. We try not to do foster care. We really explore that option with relatives very, very thoroughly. But if there is extreme safety risk, we intervene very, very quickly.
Great. All right. I noticed that you said that a lot of families that are affected by parental substance abuse, that many times there's mental health issues and trauma in those adults' lives that have led to that. Yes. To begin with. So how to START assist with the mental health and the trauma for the parents?
Yeah. Like I said, we have, it's a, when you have substance use, you're going to have trauma. You're going to have mental health. People don't just wake up in the morning and say, hey, I want to be on meth for no reason at all. So what we do is Mountain Comprehensive is very, we have access to the licensed clinical social worker. So Mountain Comp, when they go through treatment through Mountain Comp, or anywhere really, but our treatment provider, they are automatically getting a substance use assessment and a mental health assessment. So these individuals are getting diagnosed with mental health disorders or mental health, diagnoses immediately that they may not have even known or didn't know how to say it. So with that assessment, the mental health and the substance use, we have that full picture. And immediately when they get treatment services, they get with a CADC, which is a certified alcohol and drug counselor, but they also get referred to mental health therapy. And Mountain Comprehensive has medication management on site. So they'll get set up with a medication management appointment should they wish to go there if it's recommended. So they'll have access to mental health medications. And most of the treatment facilities here in Owensboro will refer to therapists if they don't have a therapist on staff, which most do. But that's part of the whole treatment process, is that we can't just address your substance use, because if you don't address the issues that led to it, you're not going to, you gotta heal it all. You know, so we're setting you up for failure if we don't address mental health.
All right. Got another question. If inpatient services are recommended for the mother of newborns exposed to opioids, what happens to, cut off the question there, to the newborn?
Okay, so when infants are born and the mother decides that she's going to go like to an inpatient treatment facility, there are several inpatient treatments that allow infants to go with the mother and stay there. We have had several that have done that. They have gone through long-term treatment with their infants there. And we work those cases just like we do if they were here, with the weekly contact. If anything issues arise, we're notified immediately. But you know, most of our clients don't take advantage of that that service, and it's mostly because they have other children. So if it was their first child, they sometimes will be more apt to go. But most of them, they have other children, and they can't fathom leaving their other children, being away. So a lot of our clients opt to do like the intensive outpatient. They have their own autonomy, so they pick. Some opt to do the intensive outpatient. If they do a 30-day residential, they usually, when we have a supervision plan in place, they will just have the supervisor keep the infant until they're finished with their 30-day program, and then they come home.
Anyone have a question? Well, I'll just keep asking, so I'm gonna pause to see if anyone has any questions. No. Let me just jump back in then. If, say, they do take advantage of that inpatient and they go to that facility, does the START team stay in touch with them during that time, or do you just wait for them?
No.
Okay.
So pre-COVID, Freedom House is the long-term facility in Louisville that a lot of our clients choose to go to. And prior to COVID, I would drive. We'd have weekly phone calls, but I would drive to Louisville and see them. And then immediately say they complete their treatment program. They complete the treatment 6 to 9 month program. They get home to Owensboro, and within a day, we're all back at the table. And it's just like how they were here. But no, I drive. I go all over.
That's awesome. Great. All right. New question. How else might a child or parent be referred to START? I think we covered it, but you can.
Yeah. So there's two ways. It's normally through the referral process. So a call has come in to our centralized intake office, and it's been accepted for investigation. And an investigator goes out, either the START investigator or another investigator, and assesses and sees that we have a substance use case that is in need of services. They're going to be opened. They're going to have an open case, and it's referred to START through that. Or sometimes families, or for some reason it hasn't come to centralized intake. They identified that this is going on and went straight to the courthouse and filed a petition for emergency custody or custody, and it come to the attention of the temporary removal hearing that, hey, this hasn't come to DCBS. DCBS has no knowledge of this. And so the judge's staff usually will contact us to put the referral in, and then we assess and accept. Those are the only two ways that we can get a referral.
And for those of you that are on here that maybe aren't familiar with the process, when she says they come through our centralized intake, our is the DCBS, or the Department of Community-Based Services, that's where START is actually located. Their offices are in the DCBS building. I take that for granted because I worked there and knew that, but it just dawned on me while you were speaking.
Oh, yeah, yes, and I'm sorry. Yeah, so, this is a fun fact. You can put it in your bank. So, Kentucky is called a centralized intake state. Back a few years ago, in order to get a report in, you would have to call the office directly. That posed a lot of problems because there was staff shortages and some referrals would get lost. So every region has a intake office, and that's all they do all day, every day, 5 days a week, is screen referrals. So when you call a report in, it doesn't come to me at my office. It goes to our centralized intake that's located in Glasgow, and then that's all they do, and they send it out to wherever it needs to go in our region, which is Henderson, Union, and a bunch of other places. Bowling Green is big.
Right. And when those calls, and I think you may know it just from your previous work with the actual DCBS intake and investigation office, when those calls come into centralized intake, how long does that person that it's filtered out to, they are to get in touch with that family within how much time?
Oh, okay. Well, so I don't know if you can write this down. Acceptance criteria or the standards of practice that these, Child Protection Services has to go by is accessible to the public. So every allegation is assigned a category. So every category has a different time frame. So it could be up to 4 hours imminent, which is, this is bad, you have to go now, to 48 hours. 48 hours is usually the maximum. But my cases are considered high risk. So we usually don't have very many 48 hours. We're usually in the 4 hour to 24 hour. But from the screening process, it just depends on how busy they are that day, but every intake goes through the screening process, and supervisors are usually notified within 30 minutes to an hour.
I asked that, I didn't mean to throw you under the bus there. I know that's not what you actually do, but I know a lot of times, and I'm sure you remember when you were at CASA working with new advocates, it is a frustration a lot when we have folks call our office and they've called centralized intake multiple times and they don't understand why nothing's getting substantiated and the cases aren't being, and so they'll call us. And so I just kind of wanted to give them an idea that there is an actual time frame. And it's got a lot to do with the wording of when someone calls in and what they say, because sometimes folks will call in when they're in the heat of the moment and they're very agitated and they just throw out a bunch of accusations, and anyone can do that. So keep that in mind when you're working with families. A lot of times they get upset with the DCBS office for not, but there are reasons. And
and like I said, there's public access to the acceptance criteria, and Susan, like you said, it's not exactly what is said, it is how it is said. So they require specific verbiage. It can't be vague. It can't be. It's got to be usually extremely specific. And there's key terms and key phrases, and they have to meet certain criteria. So they always have, which is it's public knowledge. It's on Google. If you look it up, Kentucky acceptance criteria, they have that pulled up. So they read a referral and say it's like, child tested positive, or urine drug screen tested positive for methamphetamine. The substance use criteria says that urine drug screen at delivery is positive for a substance. Boom. That's all they have to see. Everything else is
right.
So it's very specific. So it's very frustrating. It is very frustrating. Yeah. I've been there myself. I've had referrals that I've made that have not been accepted.
Right. And I said that because I, as well, have worked with DCBS as part of DCBS for many, many years. And I've assisted others that are asking and think I've got them under the understanding of how to call in that that intake referral and they word it wrong and then they're upset and it's like, well, so
yeah, it happens. It happens.
right. Yeah, didn't mean to.
And I know I'll see something with my own eyes. I know what happened because I was there, and
Right.
It's
Okay.
frustrating.
Does anybody have any questions about that process or anything they want to add to that? Any personal experiences they may have had with that process gone bad? All right. Well, Molly provided me with some information about the START team prior to this, just to kind of help me familiarize myself better. And I was reading through some of the statistics that you provided, and I see one of them was that mothers who have participated in START achieved sobriety at nearly twice the rate of those without. And that's a staggering increase of accomplishment. So can you elaborate why you think that the numbers are so good once they go through START? Because we have so many programs that we feel like that get placed in the homes, and a lot of times it just doesn't work. What is it about START that you feel like works?
So, and I'll take this to the bank. I believe that START is so successful because of the family mentor. And as well as we are getting in there right during the crisis, but also is that we have a high level of accountability. And I am not overwhelmed. There are workers that are, we have 30, 40, they have 30 and 40 cases, and they're all falling apart. And I do not have that. I kind of say that I'm able to practice social work how I think that it needs to be practiced, but I am very involved in every decision and I know my clients know me. They have CG, CG has been there. She has had, it's one thing for me to say I'm empathetic, I understand, but I have my children in my home. I've never had a substance use disorder. And coming from a social worker who you think that just want to take your kids and just want to punish you, it's hard to want to work toward that and to getting your kids back or work toward having a good relationship, because how could you ever understand me? You've never been there. But CG has. CG has had her life restored by that, and she knows what they're going through. And so with us together, we're able to really, really make not just, we're a very personal, and that's just a gift. That's a gift to me. And so I believe that's why we are so successful, is because we are right there every step of the way. I have the privilege and the luxury to be able to be very, very involved.
Right. That's awesome. And I think that we can all relate to that. If you have someone that's been, when I was working in the building, I specifically recall just overhearing a conversation with a START mentor talking about family, and they were specifically talking about, I believe at the time, marijuana had been found and they were wanting to remove again, and the START mentor was very upset and saying they have come so far that in comparison, she was advocating to keep the children in the home, because if you look at it from the standpoint of this was a family that had methamphetamines cooking in the basement to now there's possibly some marijuana, and do we really want to traumatize these children? So I think for our new, I'm saying that just for our new advocates, that as we discussed in training, a lot of times the minimum sufficient level of care of what is normal and what's okay. We have to sometimes step back, because we, just like Molly said, she's got her children at home, and sometimes, it's difficult to relate to someone that's had their children removed and has worked hard to get them back in. So it's always you just gotta constantly check yourself and realize that you're not,
it's constant. And CG, like I said, CG is my mentor, and she's my partner, and a lot of people wonder, like some people have asked me, like, is she my assistant? Is she, you know, just another person that I'm like over her and am I her boss? And I'm not. I'm her partner. And that is how I look at it. There is no decision that I make for anybody, any family, any child, that CG is not involved in every decision and everything that I do. I consult her because she is my equal. I can't do my job without her. And so everything is, we do it together. And if we have a difficulty, we have supervision, and that's what supervision is for. But you know, CG checks me before I wrecks me.
Gotcha. Oh, and I know one of the other statistics I read was that 75% of children remained or were reunited with their parents at case closure, and those numbers are just staggering for us. They're great. And to hear that, it seems like it'd be extremely beneficial for START to be involved in every single case that has a child under 5 that has substance abuse.
It should, and that's why it's so important. That's why my work that I do is so important. And that's why I take it so seriously, and that's why I'm so passionate about it. It's not just for the services that I provide for my families and the families that I work with, but the START programs statewide and nationwide. We are going in front of the federal government to change the complete welfare system so that instead of every social worker has 40 plus cases, that we have the means, we have the resources and the funding. The funding is the most important to do
so this. So it's a possibility that you're going to increase it. Yay.
Oh, yes.
I'm actually looking at Kristen because I know Kristen is sitting here thinking, why are they not involved? Kristen is one of our advocates has worked with the case for well over a year, that has twins that are both 2 or below, and I know she would have loved to have had you guys involved, and is probably frustrated to understand that you can't now come in.
I know, and I wish, but that's why I'm doing the work that I'm doing, and that's why I'm so passionate and adamant about doing good quality work. And the numbers speak for themselves. And Davis County is in a great position to hopefully, we're going to expand our START program so that maybe we can have 4 workers and 2 investigators. I would love, we are really working hard, and we have some of the best. We just had our meeting where they talked about our numbers, but we have some of the best numbers in the state. So if we can expand, that's 15 more families that we can get into our program.
That's awesome.
Yeah.
Awesome. Well, we're closing in, but as always, CASA continues to work to build the bridges with other agencies and trying to work collaboratively in the best interest of the children we're all trying to serve together. What would you suggest to our advocates, especially our new ones that are on here and the rest of us as well, in order to stay more involved with the cases that we jointly do share with START? As far as like the START team meetings, how can we stay up to date on what, I know a lot of times we'll come to court and it's like there's a START worker there, but we haven't, as CASA advocates, maybe had that opportunity to work together. So how can we do that?
So I've only had 1 case with the CASA. And
why is that?
I think it really is just that, which this family asked for the CASA, which I think was they advocated for CASA to be involved, and I love it. They closed successfully. But I really think that because it's so intense and we offer so much at the very beginning when CASA is usually appointed, that they don't want to overwhelm with 1 more person. But, I always think that once we get through that little hump, because the beginning is crazy and very intense, once we get further on, if they could be appointed, I would love that.
Well, and typically the CASAs, when we do get appointed, we're not really supposed to start working with the family until we've passed adjudication.
Mhm.
So by that point, hopefully start would be, I think that's what I was getting at the point that we can be involved. What
Mhm.
can we do to make sure we're involved with the start team? Just reach out to you.
Yeah, I mean, it's kind of one of those things where I think that when we have the stakeholder meetings with the judge and staff, that, asking about, having this discussion with the supervisor, like start supervisor, CASA, workers, the judge, to talk about what more CASA can do for us. I mean, I personally, I like it.
Well, when you first started this conversation, you made the comment about how the START team is more involved than anyone else in the process. And we as CASAs like to think many times in some of our cases, not all, but some of our cases, we are the ones that know more about what's going on because of our involvement once we
Yes.
do get to the point of being. So that's why I was thinking together, if we work collaboratively, we would know all.
Yes, I mean, that is a very accurate statement. And you're very, very right. When you guys are appointed to a case, you very well could be, because our procedure is, well, when I was on an ongoing team, another team, you saw your kids once a month. And if you had 40 of them and there's 30 days in a month, sometimes it happens. So that's why CASAs are very important.
Well, we're gonna make you our messenger to take that to your powers that be and
Yes.
let them know we
I don't
want
know. I wish I
we
had
want
more
to work with START.
Yeah, I think I wish I had more power maybe one day, but I utilize my advocate. Like, I utilized my advocate when I had her. In other cases that I did before I came to START, I utilized my advocate a lot because I see the benefit in the relationship.
Right.
I think too, is that something that would help us, and then they might, it might help as well, to get more CASA advocates in with our START clients, and is to really, really focus education and training on the disease concept of addiction, and really getting a solid training on substance use and how substance use affects families and how substance use affects the brain and the children. When we get involved, and the addictions concept, the disease concept is a very, it's the truth, but when we get involved and you suffer addiction, you lose the choice. You can't choose. And so your brain it's disease. So when you have a good grasp of that, it makes you a more compassionate worker, more, compassionate advocate. And you can really change things with that perspective.
Right.
So, but, as far as START, we'd love to have you. I mean, if we can get a stakeholders meeting or a meeting set up with, we're more than, I think that, I don't know if Rosemary or one of the supervisors, because I never asked for CASAs when I always felt like it was at judge's discretion.
Well, I ask all the time. I ask the judge to appoint us to cases
Yes.
quite often. So I'll make sure if I hear the START team to see if we can get on those as well. Just
Yes,
so we can start working.
you're more than welcome. We would love to have you.
Awesome. Well, we're closing in on an hour, so we want to again thank you. Does anyone have any closing questions before we let Miss Molly go back to her twins? She has small children in her home. Oh, lucky you.
I know. You guys would be in for a treat if they were.
If not, I think, let me make sure we don't have any questions in the chat box that we haven't answered? I don't think we do. That being said, thank you so much, Molly. We greatly appreciate your time and your expertise with START. And I think we're all feeling better about our knowledge of START now. So
yeah, thank you for having me. And I can send you guys my email address if you'd like. If you ever want to reach out to me or have any more questions, you can feel free to contact me.
awesome. We appreciate that so much. Thank you, guys. Thanks
Thank you
to
so much.
everyone else.
Thank you.
Thank you, Molly. We'll talk soon.
Yes, bye.
Bye.